Imagine a land of beauty near the southern tip of the world, surrounded by the majesty of the Andes Mountains on the east and the white-capped Pacific Ocean to the west. You will be in Chile, a country shaped like a string bean stretching down the coast of South America. Chile is as long as America is wide. Into this tranquil landscape came devastating years of political upheaval. The turmoil increased the gap between people who had money and those who didn't. While some lived in comfortable homes, shanty towns became home to thousands of Chileans thrust into poverty. In these hard times, the Chilean spirit of survival was embodied in the EPES organization. The grassroots program was created to champion community health in the neglected populations. EPES stands for Education, Popular, and Salud, or Popular Education for Health. The group's name describes its mission: healthcare for everyone.
Through the work of the EPES network, we try to approach 3 areas: creating a positive environment for women, providing education, and access to social and health services.
EPES professionals train local residents to become health promoters in their own communities. The promoters, mostly women, first learn about healthcare issues. Next, they are trained to understand what their community health needs are. Finally, the health promoters work to improve the health of their neighbors.
EPES has trained us so we will be able to work with other people. We have learned about AIDS and other sexually transmitted diseases. We've also learned about the environment. These things we have learned, we're now passing on to other women.
EPES promoters target major health concerns including respiratory infections, breast cancer, mental health, environmental pollution, sexual and domestic violence, and HIV infection and AIDS.
We believe that by empowering women, we are strengthening their self-esteem. We are giving them the tools to believe in themselves and stand up for their rights. And it is not just for them, but for the family they live in, their children, and the community as well.
People in the community are often neighbors of the EPES advocates, so they're comfortable talking with them about health issues. EPES develops games, videos, and print materials to help the health promoters deliver their messages. In fact, the EPES games have been distributed to grassroots organizations in more than 30 other countries. Health promoters find creative ways to educate. Murals raise awareness about domestic violence. Messages attached to clothing speak to the issue of breast cancer. EPES may work with an individual family's health concerns, or the group may take on an entire community's health challenge. In the city of Concepcion, a neighborhood was actually built on a factory garbage dump. The health promoters worked for 9 years to encourage factories and government to clean up the site. It's now a park. The Evangelical Lutheran Church in Chile strongly supported the group's beginnings. Today, EPES is an independent, non-profit agency supported by a board of directors from the academic, church, and health promotion communities. Now, after nearly a quarter of a century, EPES has grown in scope and vision alongside an emerging Chilean democracy. Its impact on healthcare is felt in Santiago and Concepcion, Chile, and is moving to other Latin American countries. EPES seems to be living up to the words of the ancient Chinese philosopher Lao Tzu. Go to the people, live with them, learn from them, love them, start with what they know, build with what they have. But with the best leaders, when the work is done, the task accomplished, the people will say, we have done this ourselves. The EPES contribution to healthcare in poor communities has been amazing. Still, in a world where the right to healthcare has been gradually eroded, there is so much more to do. As EPES expands its work internationally, expectations are high that this model of grassroots empowerment will continue to change lives and communities. The work of EPES would not be possible without the unwavering support of new and old friends. There are always opportunities to extend a helping hand.
We have learned to love ourselves, love our bodies, and love our community. We may be poor, but we can still make this a nice place to live.